Getting rid of your pain is crucial to overcoming any injury. Unfortunately, many drugs like opioids have some very harmful side effects, and common therapies like ultrasound, e-stim, and TENS therapies are shown to be only as effective as the placebo or fake treatment. So why are they common practice? Well, that's a good question, and unfortunately I can't seem to find an answer that's both ethical and scientific. Now, a lot of people ask about ice or heat. As long as the area is not red or swollen, it doesn't really matter whether you apply ice or heat, and research shows it's going to have minimal effects on your pain levels. So do whichever you find to be the most relaxing. But what really works? Well, as far as supplementation goes, you can ask your doctor or pharmacist about fish oil, Mauriva turmeric, or magnesium glycinate, all of which have shown to help decrease pain levels without severe side effects. Furthermore, if it hurts, don't do it. Research does not agree with the age-old motto of no pain, no gain, and in fact, it's quite the opposite. Less pain is more gain. Now, what research shows to have the greatest effect on long-term pain levels is something called pain biology education. And I like to use this technique alongside some deep breathing. I'm going to go over the techniques, and then I'm going to have you pause the video and give it a shot on your own. Allow me to start with some pain biology education. When we experience an injury, no matter where it is or how severe that injury is, our brain is going to interpret the severity of that injury and decide how dangerous we believe that injury to be, and that is going to dictate the amount of pain that we feel. And this goes with the phrase that pain is in the brain. So in a way, it's our own personal interpretation of our injury that dictates how much pain we experience. Take this example. Say you have two people, a ballerina and a pianist. You give each of them a decent cut to their finger. The pianist is going to experience more pain because he interprets the injury to be more dangerous because a pianist uses their fingers to play the piano. On the other hand, a ballerina may interpret a finger injury to be less dangerous because a ballerina is more concerned with his or her feet. Now here you have two people, same injury, different amounts of pain. This doesn't mean that the pain of the pianist is unreal, it just illustrates that the human mindset is often more powerful than the injury itself. Now, as long as you've talked to a skilled clinician and determined that your injury is non-life-threatening, you can begin to think of your pain as not dangerous. Think of it as healing pain. And I want you to think about some of these concepts as you perform some slow, deep breathing. What I need you to do is find a relaxing, quiet space. You can sit or lie down, and you can close your eyes if you like. I want you to start to take some nice, slow, deep breaths lasting about 5 seconds in through your nose and 5 seconds out through your mouth as tolerated. Allow all the muscles in your body to start to relax and unwind, and continue your deep breathing as you silently repeat these phrases to yourself. My mind is in control. Pain does not mean danger. I am now in the healing process, so the less I fear pain, the less I will experience pain. You're going to continue slow, deep breathing in a relaxed manner for 10 minutes total, and you're going to occasionally come back to these phrases and silently repeat them to yourself. Now keep in mind that you should never push through pain or ignore new pain. But if your pain decreases with this method, that's a good sign. However, if you experience any lightheadedness while performing deep breathing, you may want to take fewer deep breaths or only go for 5 minutes at a time. If that doesn't work for you, you may want to omit the deep breaths with this method, but continue to perform 10 minutes of relaxation while repeating the phrases. Otherwise, go ahead and pause the video, and I want you to perform this technique for about 10 minutes. Performing this technique for 10 minutes once or twice a day should help lead to the best results. But remember, this is not an overnight fix. It may take a few weeks of performing this technique before you start noticing a change. Don't get discouraged and try your best. Visit ptrehabdoc.com to find therapeutic workouts for the shoulder, neck, low back, hips, knees, and full body. And remember, if you're going to work out, do it in a way that helps you gain strength without sacrificing the health of your joints.